Hello, it's Dr. Christine Arsenault, PharmD Functional Medicine Certified Health Coach. And I wanted to talk about change today. Change has to happen if you want to change your life. If you want to change your life, you have to make changes in your life and what you're doing every day. And change and habits aren't really sexy. They, doing something different, making something a habit, it's not always fun and exciting or sexy, but it's those changes that are going to change your life. And if you're not making changes, then your life's not going to change. And I know most of you want your life to change because you are struggling with Lyme disease and other tick-borne illnesses, feeling fatigued, feeling tired, and you want something to be different. So if you want a different outcome, you have to do something different. The definition of insanity is doing the same thing over and over again, expecting different results. So you have to start thinking differently, start feeling differently, start having different habits, different patterns in your life, your thought patterns and also your actions and what you do. So I felt like talking about change today because I've been having a lot of changes myself. I've been moving around to different areas. So I'm in Florida now. And I've had a lot of changes lately, and I'm an expert in change because I'm a health coach. So that's what I do, is I help people change their lives. I also grew up as a military brat. So we were moving around constantly, and my friends were moving around every 2 or 3 years. So I was used to my environment changing. I had to adapt. It's kind of just a way of life for me. And in order to get healthy after I had Lyme disease, I had to make changes in my life so I could get to that place of health. So health coaches support you in making those lasting lifestyle changes that are going to really improve your health outcomes. And I thought it was interesting that the CDC has top 5 behaviors that they list for preventing chronic disease. I know Lyme disease is a little bit different because it's caused by a bacteria, but it's still chronic in a lot of cases. A lot of people that I talk to, a lot of people in this group. And once it becomes chronic, it affects everything. And it's a lot more challenging to treat. It gets trickier. So the top 5 behaviors for preventing chronic disease, according to the CDC, are not smoking, regular physical exercise activity of some kind, moderate alcohol or no alcohol use, having a normal body weight, and having sufficient sleep daily. What's interesting is out of these 5 things, only 6.3% of Americans engage in all 5 of those healthy behaviors. So that's pretty low. So if you have a chronic disease, not only do you want to be doing the basics like not smoking and not drinking alcohol, not doing things that are going to cause direct harm to your body, but you have to do even more than that. So you have to do more than those 5 basics. You really have to change your life if you have a chronic disease, if you want to see changes. So what kind of behaviors do you need to change? Well, there's, gut health that you have to learn about. You might have to make some changes regarding your gut health. That might be supplements, that might be diet. Detox, the toxins that you put in, and detoxing to get things out of your system so that you can heal more optimally. That could involve some changes. Some of you might have never thought you'd be doing coffee enemas before. So you might be living a little bit different than the average person. You might have different habits that you have to implement in your life. Food. I know food, what you put in your body, is really important, can really help or hinder your healing. And so, sugar feeds a lot of the things that we don't want, the candida, different bacterias. Nutrients are really important, getting all of your phytonutrients, making sure you're not deficient in anything so that your body can work optimally, your immune system can work optimally, and get rid of pathogens that aren't supposed to be there. Movement, I know that can be challenging for people. You're probably really fatigued, probably in pain, but some kind of regular movement is necessary, even if it's more restorative, yoga, stretching, something like that. Sleep. We all know how our sleep affects our healing. And then our thoughts and our emotions, those are so often overlooked. But if you could start to change your thoughts, if you can change your emotions, if you can learn how to handle your emotions, how to feel them, how to allow them to go through you, how to change negative thought patterns and use your mindset to your advantage for healing, those are going to have such profound benefits to your health. And it's going to help you get there way faster than just focusing on a physical protocol. So some changes around those areas can be good. And that includes anything that you ingest. So even media, social media, things you see on TV, friendships that you have, conversations that you have, negative or positive people in your life. Those are all really important. And then, of course, your treatment plan, your supplements or herbs or medication or whatever you're on, you might have to make some changes in that as well. But the bottom line is you're going to have to change something if you want your life to change. So you might as well start getting comfortable with change, getting familiar, or being comfortable being uncomfortable, and just knowing that you're going to have to live your life differently if you do want to get better. And changing your behavior is hard, and people don't often know how to do it. And even if they're given the information, that doesn't mean that they can then go make those changes. So having somebody for accountability can be really helpful, because it's hard to do it alone. And even though I'm a pharmacist, I'm a health coach, I knew a lot of the changes that I had to make, I also needed to hear it from multiple places. I needed, spiritual mentors and health coaches and different practitioners to kind of help me sort it all out, put it all together, and hold me accountable. And I found it was most useful when I worked with people who taught me to empower myself. Because there's a difference between giving your power away, paying a doctor or practitioner or somebody to fix you, and working with somebody who helps you see how your actions in your life affect your health and make you realize that you do have a lot of power. You have so much power in your thoughts and your emotions, and knowing how to channel that energy, and just knowing that your body is this incredible thing. It has this incredible innate ability to heal itself, and all it wants to do is heal. I mean, you cut yourself and your body knows exactly what to do to fix it. All you have to do is give your body tools to make it as healthy as possible so that it can continue to do what it's supposed to do. And it's a lot more complicated if you have chronic Lyme disease. There are certain supplements and medications and things that definitely can help you. But it's those everyday changes that you can do. Even if you don't know if you're on the right protocol, you're not sure if it's working, if you can start making those changes in your life, your food, your detox, your thoughts, your emotions, everything that you can do on a day-to-day basis, it's going to help your healing. So if you're not making changes, if you're not implementing them and keeping them, it's going to make it a lot harder for you to get to that place that you want to be. And that's the other thing, is to get to that place that you want to be, you have to become a new version of yourself. That means that you have to let go of the old version of yourself now. So that's sad. You have to let that person go in order to become a new person. So you have to give up something for something else. That's part of change. And that's a hard thing. I've had to give up a lot of friends, a lot of situations, different things in order to become a new person and have a new life and be healthy. And so change can be hard. You have to give up things, and it's hard to do alone. Having an accountability partner, having friends that can help you, a group like this, so you have other people that you can ask questions to or that can hold you accountable, that can be really, really helpful in this process. And what I really help teach others is to get into that vision of what they want and see how their goals are going to affect that vision. So what's your overall vision? Can you feel into that? Is it that you want the energy to go hiking, you want to take your family for a hike, or you want to play with your grandkids, or what is that thing that you really live for, the reason that you're living? What is your purpose? And if you can really feel into that vision and see how important those everyday things that you do, your goals are to get to that. And the more that you realize that you have power and you have control, and it's not just about doctors fixing you, but it's about what you can do on a day-to-day basis, and empowering yourself with education and tools and learning how to make those changes, having somebody to help hold you accountable. And yeah, just realizing that you have all the power. That's how I overcame Lyme disease, is I realized how powerful I was, how powerful my body was, how it can heal itself. And I realized that I have everything I already need inside of me. And it makes it a lot easier to listen to your body and to just every day do the things that are nourishing your body. And instead of hindering your healing, you can nourish yourself and really focus on that healing and get it to a place, just get much further and much quicker when you work on those everyday changes. So, I'll just leave you with a quote by Zig Ziglar, which is, "A goal properly set is halfway reached." So just setting those goals, just thinking about that vision, just feeling into it and realizing that the changes that you're making now may be hard. You may be living like nobody else and having to do all of these things and really struggling, and nobody else might get it and really understand you. But if you can see that overall vision and know that you can get healthy and know why you want to get healthy and what you're going to do, and realize that you have to give up this version in order to get there, if you can really set those goals and start working on them day by day, every single day, you are going to see much more results in your health than just focusing on finding the right protocol on the physical level, because it's body, mind, and soul. It's more than just healing that physical body. If you want true healing, and if you want accelerated healing, and if you want healing at a greater level than you even imagined, then you have to incorporate the mind and the soul along with the body. That's what I found to be true for me. So I hope you have a wonderful Monday.